She said, my boy, I think someday you'll find a way to make your natural tendencies pay. You'll be a dentist. You have a talent for causing things.
Joining us this morning, our friends from Titusville Area Hospital. Kelly Clark. Hi, Kelly. How are you?
How you doing today?
Good. Good to see you this morning.
Good to see you.
Every month you guys come in, you bring in somebody great, and without even talking to, I know this is going to be a great interview.
Right.
Who'd you bring in this morning?
Today we have, he's going to be starting our new dental clinic at Titusville Area Hospital. His name is Dr. Rockwell, our dentist, which is part of the physician services in our rural health clinic in the hospital. So we're really excited to have him come aboard and open our new dental clinic soon.
Very nice. Dr. Rockwell, nice to meet you.
Nice to meet you.
Welcome, welcome.
Thank you.
Tell us a little bit about yourself.
Well, I'm originally from a town called Brownsville, Pennsylvania, in southwest Pennsylvania. I went to undergraduate school at California University of Pennsylvania. I did my dental school at the University of Pittsburgh. I did a residency after that at West Virginia University Hospitals. And then I moved up to the Clarion area. Right after that, I've opened several hospital dental clinics. One was in Bradford Regional Medical Center, and then the most recent one was Warren General Hospital. I worked there from 2006 to 2018. And I opened my own private practice in Warren in 2018. And now we're opening this clinic at the Titusville Hospital.
So let's backtrack a little bit. At what age did you know this is what you wanted to do?
I'm not exactly sure, but when I was in kindergarten, my kindergarten teacher's husband was a dentist, and we learned dental tooth anatomy back in kindergarten. As a matter of fact, when we learned it in dental school, I thought it was a joke at first because it was so easy. So we were exposed to a lot of dental things in kindergarten, believe it or not. So
did you enjoy going to the dentist?
I actually didn't mind going to the dentist. I had a very nice dentist. He worked all by himself, and I didn't mind at all.
Yeah, well, it's weird for me because it's one of those things where, like, when I first go and sit down, it's like, the nerves. But then the moment you sit down and it just, I don't know, they make it more relaxing and.
That's what we try to do, make it more relaxing as soon as you get in the chair.
Yeah.
Exactly. By talking to you and just getting to know you. So.
Yeah, I think it's maybe just being able to see what's going into your mouth. I think that's probably the part that gets people. But
that's it,
That's it. So the clinic side of things, what the passion there to help with something like that, as opposed to the private side of things?
Well, I enjoy working with people, and I enjoy people of all ages, and I enjoy helping people, and I like working with my hands. So it's a combination of working with people and helping them with either sometimes getting them out of pain, but a lot of times it's a somewhat cosmetic thing too. So, and maintenance, preventing them from having pain. So it's just nice to work with people and to help them and to help prevent them from having problems.
How important is a smile?
A smile is really, really important to people. There have been lots of surveys, and they have said, would you give $1 million for your front tooth? And everybody says no. So
wow.
So that's how important a smile is.
But we're talking, just a lot of issues that if you're not comfortable smiling or comfortable with your teeth.
Right. It can hamper your social development to some degree.
Right.
You're afraid to speak or smile or interact, and a good smile gives you good confidence, or helps give you good confidence.
And that's just it, right? That can help improve going to school. It can improve your what happens at the workplace. It really is important.
Absolutely. Not to mention all the health aspects of good teeth, good oral care, and good oral health. So.
On the kids side of things, obviously, there's been a lot of horrible information that's been coming out, with younger kids struggling to maintain, that a healthy smile, healthy teeth, and that causes issues at school, and that just continues to grow. So it's trying to reach kids at a young age and helping to prevent a lot of issues down the road.
That's exactly right. We start treating patients at age 1. That's the age you should bring your child in. And you can educate the parents, and you can get the child used to coming into the dentist. Generally, you don't have to do anything at age 1 except for a quick exam. And when you start at an early age, the child gets comfortable with you. In fact, a child that starts at age 1, generally by the time they're 6, 7, 8 years old, they're so comfortable. They're more comfortable than an adult. That's the age we want to get them, because you can prevent disease. You can, just by preventive home care and just by knowledge of what to do. So you are exactly right. Starting early is the #1 key.
And those 6-month appointments, those checkups.
Oh, absolutely. The 6-month appointments are very important, because you can track, maintain, and if something happens within 6 months, it's generally easy to fix. If you let it go for a couple of years, you could have a much more tough situation for the child.
Yeah. Kelly, for the hospital, this was an important aspect to kind of bring back, wasn't it?
Right, it was very important, mostly because the insurances that we're going to accept are CHIP, Medicaid, medical assistance insurance, and in this area, the population without insurance is very underserved. Private care dentistry does not accept those insurances, so a lot of times, they're showing up in the ER. They're showing up at urgent care. So what happens is, they're not really getting the care that they need. It's kind of just relieve some pain. But what they need is to have the dental care done to prevent any further damage and get rid of the pain. So we're really happy to bring that aboard because, just like I said, the population that has that insurance is really just underserved in this area, especially the children. So we're hoping to, reach out to the schools and let them know that we do have this clinic available. So. And
we know that school districts deal with, kids who are sitting there and they have a toothache and they struggle to learn, and it's just it's not a good situation.
Yes, definitely. And, there's a lot of teachers out there that, so we send a note home saying we're having dental pain, and the parents are like, well, we're trying to go get into a dentist, but they don't accept our insurance. So, the need is definitely there. So if we can reach out to the schools, and let them know that, yes, this is what we're doing, and this, you have some options. So we hope to really, solve a problem there with some issues with kiddos going without dental care.
Yeah. So, Doc, when should things be opened up and ready to roll?
Well, any time now. It's a matter of just finishing up things with the Department of Health. The clinic's ready to go itself. The Department of Health has to just kind of look at everything and approve it, which should be no problem. It's just a matter of procedure. So it's hopefully early October, mid-October.
Oh, wow.
Yeah,
okay,
soon.
So it's a couple weeks away.
Yes.
Very nice. It's hard to believe we're heading into October.
It's hard to believe, isn't it? Yes.
Which leads you into trick-or-treat and lots of candy this time of year. So I'm sure you probably cringe a little bit on some of that stuff.
Yeah. As long as you brush your teeth after eating candy, you're okay. Then don't eat it all year round.
Yeah.
I don't want to take it away from the kids.
Well, my wife and I volunteered one day to go to lunch with one of our kids at school, and the kid beside him opened up his lunchbox and pulled out a can of pop and Little Debbie's and chips. That was all they had. Mm-hmm. I'm like, this is not a good situation.
Mm-hmm. That's exactly right, yeah.
Yeah, and obviously we know what that can lead to, a number of issues, but just not good. You're watching The Morning Drill on Stream Television and on Armstrong's Neighborhood Channel and listening to it on the Allegheny News Talk Sports Network. Doc, will continue with you in just a moment. Kelly, a lot of other things are happening as well.
Yes, a lot of other things are happening as well. So I know we spoke a little bit last time about the emergency department entering their final phase starting in October. So this phase is going to start on the outside.
Now that's obviously we're looking at the dental stuff here.
Oh yes, yes, that's our new dental clinic,
which is really cool. We should have showed that. Yeah.
Yeah. So as far as the emergency department doing their final renovation, it's on the outside of the building. Okay. So we are changing the entrance to come through the main entrance. That period will last about 6 to 8 weeks. So we do want all the folks out there to know, if you're coming to the emergency department, you can come to the main entrance. There'll be lots of signage out there directing you where to go. There's designated spaces for parking for the emergency department. We're also going to have a security guard up front. and also a triage nurse to get those patients in as quickly as possible. So we just want the public to know that we are going to be entering that, and that is the final phase. So we are excited. Our emergency department renovation will be done end of November.
That's exciting.
So,
Congrats.
yes, very excited. Yes, yes, we are. So it's a shame no one can come in and see it. Unless under duress, but
yeah, well,
you know,
maybe there'll be a time sometime down the road when that.
So next time we're on, we'll definitely have some more photos of that. We are having a lot of people made contributions to the emergency department renovation. So we are actually having a donor wall put up to show everyone that donated to the capital campaign and throughout the entire renovation. So we're going to put that up, and I will bring some pictures of that next time we're on.
I was talking to somebody who, it wasn't a bad situation. They happened to be up there, and they really liked the privacy.
Oh, it's so nice.
Yeah.
It's so nice. Yeah. It is. Yeah.
So, but for the town gossip, now you're going to have to go to the coffee shops.
You can't hear anything anymore.
Through the curtains, yeah. Well, that's great. Congratulations. That's exciting.
Yeah,
all right. Next, you have a lot. You brought a lot of stuff today.
I did. Yeah. So next we have. So last time I was here, we brought Dr. Matthews on.
Mm-hmm.
She was our new primary care physician. So she's there and practicing. So if anyone's looking for a new physician, anyone wants to get started, she's definitely there practicing. She does have some same-day appointments available, which is really great. So yeah, she's doing really well. So, and also we have a Dr. Rubin. She's our new gynecologist. She'll be coming very soon, as soon as we have her space available, because we're in the middle of that renovation as well on that side. The Rural Health Clinic is having a renovation done. So as soon as we have her space ready, she will be coming aboard. She'll actually be here next month with Holly to talk about Breast Cancer Awareness Month, which is October. So yes, we're very excited to have her aboard, and she'll be able to, get people scheduled for their mammograms. So hopefully we can have her here in October. So
now her husband, Dr. Dvorkin, we've seen him on the sidelines at the football games.
Yes.
And that's been a nice addition to the games the last couple of years.
Yes.
Having somebody from the hospital down there on the sidelines watching over the kids. So
yeah, absolutely. Yeah. Yeah, so we were excited that, now we're going to have husband and wife doctor team there, so yeah.
All right, Dr. Rockwell, let's ask you, what opening the clinic, every time you do that, is it exciting to be able to do that?
Oh yeah, anytime you open a new clinic, it's really exciting. First of all, like Kelly said, there's a tremendous need in this community, in this whole area. So there'll be an outpouring. I think it'll be well received, and a lot of people take advantage of it. So just opening the clinic and providing that service to people who did not have access to it, and they're appreciative. So it's very exciting.
And is that, again, the clinic, that's for all ages there?
It's for all ages. We are hoping to concentrate on children like 18 and under, not just little children.
And can I just say real quick that's a tough age group. There's a lot of professionals who would rather not deal with the younger ones.
Yeah, that's true. And when I worked at Warren General Hospital for all those years, we had the same population. So we had about 60% children the entire time I worked there, just because of the extreme need.
Wow.
And they sought out the treatment, and their parents sought out the treatment. So after a while, you get used to the children. And actually, in a lot of situations, or a lot of times after getting to know children, they're easier to work on. They start young, then they grow with you, and then they know you as part of their life, as opposed to, so that brings a closer interaction.
Easier to get them to change habits at that age?
It's a lot easier if you start at age 1, 2, and you teach the parents, like you said, about the right things to eat. Don't pack just sweets and sodas, and then...
Well, even just like brushing techniques, right?
Oh, absolutely. Brushing techniques are very important. You start that at age 1, where you're having the parents brush the teeth, just very gently, with a child's toothpaste. Sometimes you just use a little finger thing. Yeah.
Just like holding my kid's mouth open.
Yeah, sometimes you have to hold them down. It's a little bit of a headlock, but It doesn't hurt them, and it's a good habit to start. Yeah,
Yeah,
you're right. You've done that.
Just one or two times.
Yeah.
Brush your teeth. Brush your
That's
teeth.
Yeah, parent has to reinforce it. That's absolutely right.
And it's twice a day or once a week?
Yeah. Hopefully it's twice a day at
Okay.
least.
All right.
Morning and night.
Morning and
If
night.
you do it one more time after supper or lunch, it's excellent. So
Okay.
yeah, at least twice a day.
All right. So, Kelly, can folks start scheduling appointments now, or should they wait a few more weeks?
They can call. I don't believe that we have a schedule set up because
Okay.
we are waiting for a start date,
that's
just to
right.
open
Okay.
from the Department of Health. But it will be opening soon, and as soon as it does, we'll definitely let the public know. You can follow us on Facebook. We also will have all the information on our website at titusvillehospital.org. The number to call is the 827-9770. And that number actually gets you in touch with all of Physician Services, which is where Dr. Rockwell will be, our new doctor, Dr. Matthews, and also Dr. Rubin.
Oh, okay,
So
wow.
that phone number actually goes to Physician Services, which is, everyone. So you can get to everyone's schedule that way. So
Now, will Dr. Matthews be teaching singing lessons?
I hope so.
Okay. We learned that last time. Any hidden talents?
I don't have any hidden talents, unfortunately. So
Well,
Dentistry.
dentistry is my hidden.
Dentistry is
Yeah.
enough.
Hopefully, it's not a hidden talent.
no,
Obviously.
that's true. That's true. What'd you learn today, Doc?
Well, I learned there's a lot of things going on at the Titusville Hospital, and it's exciting to be part of something that's growing and so energetic.
Yeah, congratulations and welcome.
Yeah, thank you. Appreciate it.
Kelly, what'd you learn?
Well, I actually learned something valuable. I mean, I was told not to bring my kids to the dentist till age 3. So just so you know, that information's out there. So, yeah.
Age 1 is the age.
Age 1.
Age
So
1.
that's
There you go.
good. That's good information to put out there, I think, for the parents.
Start 'em early.
because- Yeah.
Yep, excellent. Thanks, Kelly.
You're
Thanks,
welcome.
Doc.
Thanks
Thank
for
you.
having us.
Appreciate it.
Congrats.